Welcome back. We'll start with a new topic, tetanus. Most of you heard about the tetanus, and many will get infection from this tetanus. So you take a TT injection as well. So let's see about the topic. The causative agent is C. tetani, and the organism is present in soil and dust. So whenever you get injury, you will get the TT injection so that you won't get the infection. That is C. tetanus Clostridium tetani. The organs are present in soil and dust, and the tetanus bacilli are present in the intestine of animals such as cattle, horses, and excreted in feces. Okay, when this feces come in contact with the soil or dust, then infection will be there in the agent will be there in the dust. Then again, the healthy person come in contact with the soil and dust of infected feces, then they may get the infection. Tetanus bacilli produces soluble exotoxin which act on spinal cord, brain, sympathetic system, and motor end plates in skeletal system. Okay, so that's why you get the infection tetanus, tetani. When the bacilli enters the body, it will produce the exotoxin which act on the central nervous system. So most of the motor and sensed nerve will be affected. And the host factors, tetanus occurs in the age group of 5 to 40 years. Okay, a neonate get the disease due to the use of unclean instrument for cutting the umbilical cord, or if dust, ash, soil used on the umbilical stem. Okay, from the umbilical area, the disease may spread to the neonatal body. Higher incidence of tetanus occur among the males because they are in the most of the time they'll be out of the house and they'll be in the field and agriculture area, so they may get the infection. Females get the tetanus during the delivery or abortion because of the uncleaned instrument. And incidence is more among the agriculture workers and in rural people because they will not take much preventive measures, and they are not aware about any of the diseases. And so when they come in contact with the infected feces or infected dust, then they may get the infection. And the environmental factors include unhygienic customs and habits, unhygienic delivery practices, lack of primary health services, and illiteracy. These are the main environmental factors which will enhance the spread of this infection. And the mode of transmission, it is through the contamination of wound with tetanus spore. Okay, tetanus spore will be there in the infected feces and the dust or the soil. So when you come in contact with the when your wound wherever in the body come in contact with this infected material, then the tetanus spore may enter the wound and the body, then it may get infected. An incubation period is from 6 to 10 days, and clinical manifestation include paroxysmal spasm of voluntary muscles, okay, where the skeletal muscles are there, there will be spasms, and lockjaw, the jaw will be in the particular position, you cannot move the jaw. Okay, that is called lockjaw. And rhesus sardonicus, that is one type of condition which occur through the tetanus. Okay, there will be epistatanus. That is the posture, epistatanus posture. You cannot move any of your limbs. Uh, Next is prevention and control. Here you go for immunization. The immunization is TT. Okay. Immunization against tetanus will reduce the morbidity and mortality due to tetanus. The immunization may include active immunization. Here you are giving the immunization such as DPT, APT, and PTAP. The purpose of active immunization is to immunize the entire community regardless of age or sex. The type of vaccines available for active immunizations are: first is combined vaccine. There are types of vaccine: combined, monovalent, non-combined. So combined vaccine include DPT vaccine, that is with the it is combined with the diphtheria and pertussis. And there is monovalent vaccine. Here plain or fluid toxoid can be given, or tetanus vaccine can be given, that is adsorbed, that is PTAP and APT. So this is the active immunization. And the passive immunization, here you are giving passive immunization provide temporary protection against the tetanus. Here Tetanus hyperimmunoglobulin, that is TIG, can be given, or anti-tetanus serum. Here, serum can also be given for the prevention of this disease. Next is tetanus hyperimmunoglobulin. Here, TIG provide passive protection up to 30 days, and anti-tetanus serum provide passive protection for about 7 to 10 days. Okay? The standard dose of ATS is 1500 international unit. Okay, these are the two types of passive immunization. Next one is combined, that is active and passive immunization. Here, the person having the tetanus is given 1500 units of ATS on one arm and 0.5 ml of PTAP on other arm or gluteal region. After 6 weeks, next dose of 0.5 ml of PTAP and then third dose of 0.5 ml PTAP is given after 1 year. Okay, first you are giving ATS and PTAP 0.5 ml and 1500 units of ATS in both of the arms, and after 6 weeks again you are giving PTAP of 0.5 ml, and the third dose after 1 year, that is 0.5 ml, again PTAP is given. And the antibiotic can be used for the treatment, that is penicillin. Here 1.2 mega units intramuscularly can be given for about 3 to 4 weeks to kill vegetative forms of tetanus bacilli, that is growing form of bacilli can be killed. Those who are sensitive to penicillin, erythromycin can be used. That is the erythromycin estrolate 500 mg 4 times a day can be given, that is up to 7 days. Next, how you can prevent is through the hygienic delivery practices. Neonatal tetanus can be prevented and controlled by the clean delivery practices. Institutional clean delivery should be emphasized. If having home deliveries, then sterile blade should be used for the cutting the umbilical cord. Okay? So, in the hygienic delivery practices should be maintained to avoid the infection or a tetanus infection to the mother as well as to the baby. And the health education to be given to the community and the people. Here you should concentrate on the three cleans, that is clean hand, clean delivery service and clean cord care. And also teaching about not to use ash, soil on umbilical stem. Mothers should be immunized against tetanus. So you should advise the people not to use ash, soil or soil on umbilical stem. And you should also educate the mother about immunization of tetanus to them. That is, 2 times they'll take the tetanus toxoid vaccination during the pregnancy. So you should advise them to take. And cleaning of wound, all wounds should be washed thoroughly after injury to remove foreign bodies, soil, dust, etc. Okay? That is the because it may contain, the soil may contain the infected materials of the tetanus. So when you clean it, it may go away, and next you can go for the like wound cleaning, the proper wound cleaning and covering. So that's all about the tetanus. We'll see in the next chapter. Thank you.